For me.
Okay, grandmothers, beginning with Susan Elster. Will you just introduce yourselves?
Hi, I'm Susan Elster from the Jewish Healthcare Foundation.
I'm another grandmother.
Debbie Parker with the African American Chamber of Commerce.
Sharon Silvestri, Allegheny County Health Department.
Joyce Penrose, typical grandmother.
Cecile Swim with the Women and Girls Foundation.
Atypical grandmother.
Dodie Roskies.
Eileen Lane.
Kat Tiger with United Way.
I'm Rich Lost Wiley with People's Natural Gas.
Well,
And who are you?
I'm Karen Feinstein with the Jewish Healthcare Foundation.
We have one more grandmother.
Oh, I'm sorry.
Great grandmother.
Oh my great grandmother. Oh, that's terrific.
What's your name?
Anna Helen Camp.
Terrific. Welcome grandmothers.
Debbie Parker.
Thank you so much for coming today. There's a bit of a drizzle out there, as you might have noticed. I think we're entering a new era of the deluge. Today I really have the honor of announcing a new chapter here in Pittsburgh of Grandmother Power. And it was established, we know that it's a global movement and really exciting. I attended an exhibition in Grand Rapids, the museum there of Grandmother Power, and I was so overwhelmed. It's really incredible how many countries and cities have chapters and all of the interesting things that different chapters work on. So because we're very passionate here at the Jewish Healthcare Foundation about getting more young people vaccinated against the cancer causing human papilloma virus, we thought this would be a great opportunity, perhaps, when I saw the exhibit, to have a chapter of Grandmother Power and to begin with an objective that's so worthy. This is National Immunization Awareness Month, so what better time to not only kick off our chapter, but to bring attention to the fact that so many of our young people are not getting vaccinated with one of the few vaccines that prevent so many different cancers. So this morning I'm going to start by just giving a brief overview about the HPV Health Challenge, and then also not only are we delighted to answer questions, but we actually have a physician expert here who can answer the questions with a certain amount of medical credibility. In January, the Centers for Disease Control and Prevention named HPV the 4th largest health threat in the U.S., and I'd like to give you a little background. Dr. Anna Radovic will be available during the Q&A. Approximately 79 million Americans, males and females, are infected with HPV, and approximately 14 million people will become newly affected each year. HPV often has no visible signs or symptoms, so people who have it don't know it. For most, HPV may clear up on its own, but for others, it doesn't. And for certain strains, it can cause significant consequences. Certain types of HPV can cause almost 75% of all cervical cancers in women, 65% of vaginal and up to 50% of vulvar cancer cases, 95% of anal cancers, and 65% of oropharyngeal, that's in the back of the throat, and also at the base of the tongue and tonsils, cancers among both men and women. And I do want to say our partner in this early on, and one of the reasons the foundations got involved was because of the Eye and Ear Foundation. And the Eye and Ear Foundation was very concerned that so few males were getting the vaccine, a pathetically small number of males. And what they are seeing at the Eye and Ear Foundation and with the surgeons there is a real uptick in cancers of the mouth and throat among young boys, which are preventable if you get the 3 doses of the vaccine before you are sexually active. So each year in the United States, an estimated 26,000 new cancers are attributable to HPV. 18,000 among females, of which 11,500 are cervical, and 8,000 among males, of which about 6,000 relate to the head and neck and throat. A vaccination exists to help these cancers. Yet, according to data from the CDC's National Immunization Survey, in 2013, less than 38% of girls and less than 14% of boys got the recommended 3 doses. We've taken on the challenge of increasing the number of children and young adults who get vaccinated. Our goal is to normalize the vaccination rate for boys and girls 11 and 12. That's the recommended age when getting the vaccination has the greatest impact. As years go on, it has less and less impact. So I do want to emphasize our goal is to get young people vaccinated. By normalize, we want to bring the vaccination rate close to that of the Tdap vaccine, which is at 86%. So that's how we're going to do this, and that brings us to this meeting today. I was recently introduced, as I mentioned to you, to this phenomenon of grandmother power, which I absolutely, the exhibit was extraordinary. We have a book. The book is available. It's not an organization, it's a movement. It's a group of activist grandmothers in countries across the globe. Finland, the United States, Kenya, Canada, India, other countries. Many different cities have chapters. It's really been an extraordinary phenomenon. They're working on separate issues, but the goal of all of them is to protect our grandchildren. I would say, as an activist grandmother myself, I identified with the movement. I will say that my children sort of dragged me through the Grand Rapids Museum. They said, "You've got to see this." And I thought about, wouldn't it be great to bring grandmother power to Pittsburgh, to harness the power of passionate women who care deeply about the health and future of their grandchildren. And because we believe, a campaign that is so worthy, it seemed to be a good place to start. The other reason it's such a good place to start is that so few people are taking advantage of one of the few vaccines in the world that actually prevents a whole host of cancers. So we asked our friends at the Women and Girls Foundation, who are known for all their positive activism, to help us get a lot of interested women engaged. So I'd like to ask 2 of our inaugural members, Cecile Springer and Eileen Lane, women who are well known to me for a lifetime of activism, to talk for a minute. Cecile's a founding board member of the Women and Girls Foundation. Eileen is a longtime friend, a community activist, a person to whom you don't say no. Eileen was instrumental, I think many of you know, in bringing Race for the Cure to Pittsburgh, along with Pat Sacker, who's also here, and is also a past president of the Family Health Council, now Dazio Health. So I'm going to have Cecile speak, and then Eileen.
Thank you, thank you, thank you. I didn't know how passionate one has to be here. So thank you, Karen. I am one of the founders of the Women and Girls Foundation. And as a consequence, waking up one day and finding out I'm also a grandmother and I'm in need was amazing. I think that grandmothers do have a lot of power. I have not thought about it in a organizational sense, but certainly when we're talking about a 10, 11, or 12-year-old child, that is our grandchild. It's important. I have an 11-year-old grandchild who has just left my reach by moving to California. But now that I'm a leader, a burgeoning leader, it's going to be important for me to communicate back and forth. I had not thought about the dangers to which that age group is being exposed. And these numbers are frightening. So I am delighted to be joining other passionate grandmothers to address this issue. And I was talking to Anna about the incidence of this cancer and how people are just unknowing. I am unknowing. In fact, I didn't even know what HPV was until I started reading about it. And once you read about it, there's no reason why we all can't get together and really be a strong grandmother group to cause change in our community. This 11-year-old grandson that I have is a burgeoning designer of women's clothes. He would be such an articulate person if he also understood what it means to be part of a change in the community. So I'm delighted to be part of a beginning group. I really feel that we have a strong message, and I'd like us to be able to talk to large groups. One-on-one is one, I think it's very good, but I really think we need to talk to large groups of people in their communities, and I'm ready. So are you all as passionate as I am? Yes. So thank you very much, Karen, for inviting me, and I'm ready.
Well, as I look out at the grandmothers in their white aprons today, it strikes me that grandmothers can be quite different from each other. Let's start with what we're called. There are grandmas and Grammies and grannies. There are nanas and nannies and ninas. There are omas and bubbies and grandmas. I happen to be called Ivy by my grandchildren. And grandmothers come in all ages, shapes, sizes, and hair colors, of different races, religions, and backgrounds. And not all of us spend all our time in the kitchen either, I have to say. But of course, what we truly have in common and share is a delight in our grandchildren, the love and caring we feel towards them, the attention we pay, and the responsibilities we assume, sometimes for grandmothers on a daily basis, and of course our deep concern for their health and well-being. And it is their health that brings us here today and is the focus of this extremely important public health initiative and the campaign that we launched to promote vaccination against HPV. I think it's what calls on us to unite, to organize, to advocate, and to speak out. Now, on occasion, grandmothers hesitate to speak out. Our advice isn't always welcomed by our children nor our grandchildren. I frequently experience that. And I find myself tempering my words and applying an imaginary piece of duct tape to my mouth. But this issue, I think, compels us to remove that duct tape, to bring to bear the concern we feel and the power we can wield in order to speak out for our own grandchildren and all grandchildren. So I too am proud and determined to be part of this effort.
So this is what I imagined. One of my grandchildren, boy or girl, is 25 years old, and they're diagnosed with cervical cancer, or cancer of the throat, or cancer of the penis. And they find out that there was a vaccine they could have gotten that would have totally prevented something that is so devastating to a young person. And they didn't get it because a parent or grandparent didn't speak up and didn't insist that they get vaccinated. It's a vaccine with virtually no risk. I think about that and I say, this isn't going to be acceptable in our family or any others. I don't want that blame. I don't want that burden. I want to know that we did absolutely everything we could to protect young people from devastating cancers. So we're all here today to work on something. I only wish, as many of you are experiencing, I know so many people of all ages who have had devastating cancers. I only wish there were a vaccine that could prevent so many of them. But we do have a vaccine that prevents some of the most uncomfortable and difficult for young people to deal with. So my feeling is, let's do something about it. The vaccine is available. It is covered by insurance. I think there'd be very few arguments why we shouldn't get young people vaccinated. It really would stretch your imagination. So I say to all of us, hopefully today is the day to kick it off. Let's get the job done. and do what's right. So, I, but particularly Dr. Radovic, are available for any questions you might have about HPV, about the vaccine. And I know one of the questions the media wonder, I wonder, why the vaccination rate is so low. I really do wonder, and could probably give you a whole host of answers, but I think they're probably not very good, so I'm gonna keep working at it.
The one question that I do have is, from my understanding with my own children and their children, they're automatically given the HPV in their early childhood immunizations.
They are not. They are not, and
So
that.
they're not being offered, is that?
It depends on the pediatrician. Some pediatricians will offer it. Some pediatricians will highly recommend it. Some pediatricians will leave it up to the parent. It's very variable. In our perfect world, every pediatrician would sit down with every parent and say, and by the way, it is very important to get it while you're young. The power of the vaccine decreases as the young person gets older. The pediatrician has to be willing to have a conversation with the parent and say, do you understand, if you don't do it now, if you don't do it while your child is young, if you don't give them all 3 doses, you are leaving them vulnerable. And with every year that goes on after their, frankly, pre-puberty, pre-any sexual activity, with every year that goes on, the power of the vaccine wanes somewhat. So, maybe some pediatricians aren't comfortable having the conversation. Maybe Dr. Radovic can help us with that.
Well, I was fortunate then because my doctor did go over that with me when my children were smaller. So mine were fortunately vaccinated with the vaccine. So that's the
And I always joke, I wish we could vaccinate all the pediatricians with a strong desire to make sure they get the job.
One thing that's important to know is that every year there's a committee that gets together that's funded by the Centers for Disease Control called the Advisory Committee on Immunization Practices, and they look at what all of the research evidence is to date to decide on the timing of every single vaccine. So the timing that vaccines are recommended for children at any age is determined by what the latest research is, that the best time that your body could increase its immune response. So that's another thing about being 11 to 12. You want to give it before most people would ever become sexually active, well before, so that they have the most benefit from the vaccine. And also they find that that's a good time when a person would have a good immune response, because there are times you could give a vaccine and it doesn't really do anything for them just because of the makeup of the body and the type of immune response you're going to have.
Where did you get it?
Where you can get the vaccine, well, you can get it from the Allegheny County Health Department if you can't get it from your provider, but then any primary care provider should be able to provide HPV vaccine. And it's covered for Vaccines for Children, which is a program of funding for Medicaid if someone is if children are having problems with insurance or private insurance.
You may want to mention to people who don't know that it takes 3 doses, or
Right.
timing is an obstacle sometimes.
Yeah, it can be an obstacle because you should get the first dose and then you should get the second dose 2 months later, and you should get the final dose at 6 months after the first dose.
So it's given like the Hep B.
A little bit, yeah. But again, like the timing, and if in the future the timing changes, it's all based on the current research evidence. So sometimes that can be confusing for people. Why is this changing? But it's all every year this committee gets together and decides what the latest evidence is and how to time them.
One of the things that I found working as a nurse practitioner at Planned Parenthood, talking with young women, a little over the age we're talking about now, but 14, 15, 16-year-olds, that made me very sad is that not infrequently a young woman would say, my pediatrician talked to me about that, and I really wanted to start, but my mom's really worried, and she said, no, when I get to be 18, I can make my own decisions, then I can have it.
Right. I've heard
So
that too.
it's really hard because I know those moms are doing what they think is best for their daughter. It's one of the, or son, it's one of the reasons I'm glad to be here as a grandparent. I don't know how to be helpful to those moms so they can see the issue more clearly.
I think, oh, I don't know, Steve, but one time I was invited to speak to a group of moms in the community who have kind of get together and invite different speakers. So I think that young mothers, you know, are really looking for information and that they would welcome opportunities to increase their education level. Often people nowadays are using the internet to get their health information, and it's very, very, very common. And so it's our role as, you know, health advocates to provide them with the correct information, because there's a lot of incorrect information. And one thing I think that's important to know is there's a way to report adverse events about vaccines, and that's really to capture, you know, anything that could be happening. But all that information is available online, and it doesn't mean that whatever happened is associated with the vaccine. So sometimes some of that misinformation can be available online. So it's just important to understand who you're getting information from, whether it's trustworthy. So I think that's a great role for you to give the right information.
I think Dodie, Eileen, Dodie, Amanda.
I have two questions. One was, what's the educational component for the physician? Because clearly it has to be supported or initiated by a physician, if not by a parent or grandparent. But the other is there a barrier because of this discussing sex as a mode of transmission, and therefore people are reluctant to talk to 11-year-olds?
That was actually going to be the nature of my comment. I was thinking, as the experience at Planned Parenthood, I think that for some mothers, it's seemingly, if you're going to vaccinate your children, it somehow condones or encourages sexual activity. I think an important message would be, I mean, we give our children tetanus and typhoid and other vaccinations against diseases that we don't think they're going to get. So why isn't this on a par with that?
Right, and because of that
And not
concern,
associated.
right, because of that concern, there's been a lot of research studies to actually look at whether HPV and giving vaccine increases any risk of sexual behavior, and there's not been any association with that. And so about half of high school students are sexually active, so that's really the reality. And so we want to give the vaccine before that happens, and there's multiple factors that go into deciding whether a young person is going to become sexually active, including their family, their school, their peers. But one thing like HPV vaccine doesn't really affect that. So the important message is to talk about cancer prevention. And
that was going to be my comment.
Right.
I think that, you know, Andrea, as you start to craft our communication around this, that's the most important. Families, your parents can clearly understand what cancer prevention is.
Right.
And so taking it out of the sexual context and putting it into the real preventative mode, I think has the best messaging, and that's where we're going to have to work really hard.
Well, and I would say when my 8-year-old grandson gets in the car, he insists, if he's good, I turn the radio to a certain station he chooses. And I don't know what parents were thinking, but I tell you what these young kids are listening to. The idea that they have no idea that there's something out there in the way of sex. I think the vaccine is the least thing we have to worry about in our society, I really do. Listening to popular music, what's it called, Sweet Pea? Black Eyed Pea?
Oh, Black Eyed Pea.
I'm gonna tell you, your conversation about the HPV vaccine is going to be a lot easier than what your kid is listening to on a popular radio station.
If I may, I have one more question. It has to for the doctor. It helped me to understand how the HPV virus, is it sexually transmitted that they get cancer? I mean, where's the, how is that connected?
Right.
That's where I'm
Yeah, I
confused.
think that's a really important question, because we kind of just say if it does it really make sense. So the HPV virus is something that can be transmitted sexually, and there's also through genital contact as well. Even
So it could go through oral or
even less than intercourse,
oral
right?
kiss.
And so that's a thought because of oral. That's why there's oropharyngeal, so cancers of the throat and mouth that can happen because of HPV virus. And so when you have a virus, you can cause maybe increased cell turnover, so that that's really how cancer happens, is you get more and more cells, replicating, and then some of them start to become abnormal. And so what happens with pap smears is, because, not everyone is vaccinated, and because there's more than the virus is covered in the vaccine, women are still recommended to get pap smears of the cervix, because that's been really something that's shown to decrease cervical cancer rates. And so during the pap smear, you see precancerous lesions. So you see cells that are not cancer yet, but if you wait it out, 10, 20 years, they could turn into cancer. And one important thing about HPV vaccine is that it prevents those precancerous lesions. And that also leads to a lot of problems for young women, especially because I've seen, pap smears are recommended at age 21. So I've definitely seen HPV positive abnormal cells in my clinic already at 21. And then those girls require other procedures, which, even though you could prevent cancer, you could lead to some instability of the cervix and cause problems with their fertility.
Childbirth and-
Yeah. So there's a lot more than even cancer.
So
That
it is
it's
an
important for
STD.
women to understand that.
So it is a STD.
Mhm.
The virus is.
It's the most common
contracted.
STD, and basically 80% of women over 50 have been exposed to an infected with it. Yeah, it's basically like given that you will be infected with it.
Yeah,
I don't like that idea.
Yeah.
My question is, why is this an option and not just part of the series of vaccinations that you have to get? Good question.
In Australia, it is not optional. And as those of you remember, Governor Perry tried to make it not optional in Texas, and there was a backlash against requiring it. So I think, given the experience in Texas, governors have been somewhat reluctant to say it will be a required immunization for school attendance. Hasn't worked well, but in Australia it is. They have almost 100% vaccination.
Wow. Can we answer the question about physicians? I asked a question.
About the resistance. So there.
Well, not the resistance, but what is the plan to get, I mean, if you're part of an advisory group, you must be trying to get physicians, pediatricians in particular, to be proponents for it, and obviously some of them are, but many of them aren't.
I myself, so I'm not part of
As
this
a
advisory group,
representative.
but there is an advisory group. So one thing is how they're offered. So there was a study looking at, out of girls who did not accept or not get HPV vaccine, about 84% of them were at a healthcare visit that previous year where they were offered where they did receive other vaccines. And one of the factors that increases rates is really the doctor